Hello and namaskar to all of you. Earlier this year, I learned much about depression as part of World Health Day awareness activity at my college, and I'd like to share the same with you. I will be talking about screening of depression in a community and its diagnosis. We need to screen and diagnose this menace called depression, and that too as early as possible. But why is screening so important? It is so because depression is an iceberg disease. Just like an iceberg, less seen, more hidden, but it's there and is causing harm. Depression increases the risk of physical illnesses, for example, heart diseases, diabetes, substance abuse, etc. But the most deadly adverse sequelae of depression is suicide. This recent article in the daily newspaper states that according to the World Health Organization, depression is now the leading cause of ill health and disability in the world. Let me direct your attention to the last paragraph of this article. Read along with me. Depression increases the risk of substance use disorders and diseases such as diabetes and heart disease. The opposite is also true, meaning that people with these other conditions have a higher risk of developing depression. According to a survey carried out by the National Institute of Mental Health and Neurosciences, 14% of India's adult population suffers from mental illness. And around 10% of the Indian population suffers from common mental illnesses, which includes depression, anxiety, and obsessive compulsive disorder. Another article caught my attention, and I feel compelled to highlight it. Doctors are more affected by this disease than the general population. In fact, every year, 300 to 400 physicians commit suicide in the United States. Even though no such data is available for doctors in India, psychiatrists say it is much higher than the general population. Don't you think this is a grave issue? After all, doctors are responsible for our good health and well being. How can they do justice to their role if they are not fit themselves? As quoted by a senior professor at the All India Institute of Medical Sciences, Delhi, stress levels are very high among medical professionals. And why wouldn't that be? After all, doctors deal with the life and death of patients on a daily basis. Is there anything being done by the institution or policymakers to ease the pressure on medical professionals? The president of the Federation of Resident Doctors Association has replied in negative. Moving on, it is indeed difficult to tell whether a person has depression simply by looking at them. How can we, as a responsible daughter or son or mother or father or friend or roommate or batchmate or neighbors, be of some help? Though not easily quantifiable, there are various scales used to make an estimation of depression in a community. They include Hamilton Depression Scale, Beck Depression Inventory, Patient Health Questionnaire, Major Depression Inventory, Center for Epidemiologic Studies Depression Scale, Geriatric Depression Scale, Children Depression Rating Scale. Among these, Beck Depression Inventory is the most widely used self-rating scale. It was developed by Aaron Beck in 1960 based on symptoms he observed to be common among depressed people. It consists of 21 items of emotional, behavioral, and physical symptoms. It measures mood, pessimism, sense of failure, social withdrawal, and other commonly experienced feelings. Here's an idea. Why not take out a paper and pen and evaluate yourself now? It may improve a lifestyle or may even save a life. Check your final score in the next slide. The rating is done on a 4-point scale ranging from 0 to 3. The score given to each question should be added to arrive at the final score. If your score lies between 0 to 13, it indicates minimal depression. If it lies between 14 to 19, that indicates mild depression. If it lies between 20 to 28, that indicates moderate depression. And if it lies between 29 to 63, that indicates a severe form of depression. Moving on to the diagnostic criteria for depression, according to the International Classification of Diseases ICD 10, which defines two kinds of symptoms: core symptoms and other symptoms of depression. The core symptoms includes depressed mood, which is present for most of the day, almost every day. In case for children and adolescents, it can be irritability, then loss of interest or pleasure in activities that are normally pleasurable, also decreased energy or easy fatigability. Keep in mind that these symptoms should be causing significant socio-occupational dysfunction. Also rule out bereavement in past 2 months. The other symptoms of depression includes reduced concentration and attention in activities, reduced self-esteem and self-confidence, having ideas of guilt and unworthiness, bleak and pessimistic view of the future, having ideas or acts of self-harm or suicide, disturbed sleep, and diminished appetite. Now, how do we categorize depression? If during the last 2 weeks the person has had 2 core symptoms along with 2 other features, then he might be suffering from a mild depressive episode. If during the last 2 weeks the person has had 2 core symptoms along with 3 other features, then he might be suffering from a moderate depressive episode. Lastly, if during the last 2 weeks the person has had 3 core symptoms along with 4 other features, then he might be suffering from a severe depressive episode. This may or may not be accompanied with psychotic symptoms. But what if the symptoms do not conform to a particular category as elaborated? Is it a depressive episode which has happened for the first time? If the answer is no, then it may be recurrent depressive episodes, which means that the person suffers from repeated episodes of depression, with current episode being mild or moderate or severe. Or it could be dysthymia, which is a chronic mild depressive state that does not meet criteria for a depressive episode anytime and lasts for at least 2 years. It could also be bipolar depression. This can be ruled out by asking about prior episode of manic symptoms. They include elevated expansile or irritable mood, increased activity and talkativeness, or having a flight of ideas. It is indeed necessary to categorize these symptoms in order to provide optimal treatment for the patient. As seen in the diagnostic criteria, the clinical features of depression includes domains of psychological symptoms, somatic or physical symptoms, psychotic symptoms in case of severe depression, and suicidal thoughts. One must always inquire about ideas of self-harm proactively from the patient. A must for a medical professional is to differentiate and explore comorbid health conditions presenting with similar symptoms as depression. This is to ensure holistic treatment of the patient. Some comorbid medical conditions may include endocrine disorders like thyroid or glucocorticoid disturbances, infections such as meningitis, encephalitis, syphilis, HIV, systemic infections such as urinary tract infection, pneumonia, sepsis, cardiovascular diseases, cardiac failures, cerebrovascular conditions like infarcts, hemorrhage, metabolic disturbances like dyselectrolytemia, renal or hepatic failures, nutritional deficiency, and very common among them is vitamin B12 folate deficiency, neoplastic conditions, trauma leading to subdural hematoma, cerebral contusions. Interactions with certain drugs should also be investigated, like withdrawal of caffeine, nicotine, sedatives, amphetamines, prolonged use of certain drugs like antihypertensives, anti inflammatory, steroids, anti tumor drugs, anti Parkinsonism drugs, antipsychotics, prolonged use of sedatives or antibacterials. After learning much about depression, I believe the only way around this rapidly emerging disease is to express yourself. Do it. Let's talk. Thanks guys. I hope this video was as enlightening for you as it was for me while I was making it. I would like to thank my professor and my friends for helping me out. Thank you.